Although lung cancer is the third most common cancer diagnosed in the U.S., it is the leading cancer-causing death in the United States in men and women. With the use of lung cancer screening CTs, we would like to continue to see the rate of lung cancer mortality decrease as we have over the last decade. According to the United States Preventive Services Task Force, the people who should be considered for lung cancer screening are between the ages of 50 and 80 who have smoked 20-pack years. And what that means is a pack a day for 20 years, or half a pack a day for 40 years, or 2 packs a day for 10 years. And if those people have quit smoking, have quit within the last 15 years. So if you fall within that criteria, those are the people that are recommended to undergo yearly lung cancer screening with a CT chest on a yearly basis. In addition to that, there are people who have risk because of other environmental or occupational exposures. For instance, people who have been coal miners, or people who've worked in a Navy yard building ships, for instance. They have occupational hazards for things like asbestos, which does raise their risk for lung cancer. And then along with that are things like family history and personal history. So personal history of any other types of cancer, and then first-degree relatives who have had lung cancer does raise your risk for lung cancer as well. If you fall outside of the criteria for lung cancer screening, but you have other concerns that might increase your risk for lung cancer, such as environmental or occupational exposures, or even family history, then I would recommend you talk to your primary care physician, because there may be other studies or other tests that we can do to help assess your lung health. The first part of detecting lung cancer is usually either a chest X-ray or a CT scan, but that's only an image. But to know for sure that it's lung cancer, oftentimes things like biopsies or surgical resection of lesions are necessary. A low-dose CT is typically what we use for lung cancer screening, and the reason why it's considered a low-dose CT is because it uses less radiation than a full diagnostic CT scan, which is really important because for lung cancer screening, you're doing a CT scan once a year, so we're trying to minimize the amount of radiation exposure that you get. There's different other protocols through the CT scanner that helps get clear pictures, even though it's still a low-dose CT scan. If a nodule is found, or something that is suspicious for lung cancer, depending on where you seek care, usually the next steps are to either a specialist like a pulmonologist or a surgeon to evaluate the patient and figure out what the next best steps are, typically for biopsy or other studies that need to be done. There are 4 stages for lung cancer, the first being that the lung cancer is isolated to one part of the lung and rather small, and doesn't appear to have spread anywhere else, up to stage 4, where the lung cancer appears to have spread to other parts of the body and other organs. Stages 2 and 3 sort of fall in between that. And depending on what the stage appears to be on initial imaging, the next steps for diagnosis and biopsy can be dependent on that, as well as what happens after the lung cancer is diagnosed in terms of therapy and plans for surgery or radiation or chemotherapy. If you're diagnosed with lung cancer, depending on the stage at the time of diagnosis, it can dictate who you end up seeing in terms of treatment. Oftentimes that begins with a nurse navigator or coordinator who help figure out who your next steps are. The people who might be involved include thoracic surgery, thoracic oncology, radiation oncology, but it can also involve an interventional radiologist, a nuclear medicine doctor, other radiologists, and other pulmonary providers.